Association webinar entitled COVID-19 Resources for Mental Health Counselors. My name is Laura Giraldo, and I am the Executive Administrator here at the PHOMCA office, and I'll be your moderator today. Now, I'd like to collect some information about you, our audience, for our presenters by launching some polls. So it looks like 92% are licensed mental health counselors, licensed marriage and family therapists, and licensed clinical social workers, 4% registered interns, 2% students, 7% counselor educators, and 4% other. So it looks like most of you are interested in learning about transitioning to telehealth. So it looks like 15% of you are providing therapy in person only, 46% of you via telehealth only, 14% in person and via telehealth, and 26% neither. I am not currently providing therapy. Okay, so now that we have a sense of who's out there in the audience today, I'm going to introduce our panelists. First off, we have Erin Norton, who is a licensed mental health counselor and a licensed marriage and family therapy, serving as Executive Director of the National Board of Forensic Evaluators, Adjunct Instructor at the University of South Florida, Southern Regional Director for the American Mental Health Counselors Association, and our President here at the Florida Mental Health Counselors Association. We also have Dr. Denny joining us today as a panelist, and Dr. Denny is a licensed mental health counselor and a licensed marriage and family counselor in the state of Florida. Dr. Denny has served as past president of the Florida Mental Health Counselors Association, and she is currently a member of the 491 licensure board in the state of Florida for over 5 years now. Ladies and gentlemen, I present and welcome Erin Norton.
Hello, everyone, and welcome. I'm so glad and grateful that you all have taken time to come onto this webinar today and to share resources and stay updated during this very difficult and challenging time for our profession, and a time that I think we will all get through together as a profession. So I'm going to jump right into it. I want to make sure you know what the Florida Mental Health Counselors Association is. We are a state chapter of the American Mental Health Counselors Association, which is the largest association in the United States that exclusively represents and advocates for clinical mental health counselors, counselors who specialize in diagnosing and treating mental disorders. And having said that, if you're not a counselor and you're on today's webinar, you're a social worker, a marriage and family therapist, a psychologist, then welcome. You are welcome also, and we very much appreciate having you here today as well. Membership is very important in our associations, and I think that will become clear later on. So by all means, if you're not a member of PHOMCA, I encourage you to become a member by visiting phomca.org, fmhca.org. First 45 minutes, we already know we're going to be covering pertinent laws, 491 board rules, some executive orders, including the one that was just issued yesterday by our governor. We're going to cover precautions for in-person contact, how to transition to telehealth, how to also help clients during a pandemic. That's a new segment that I very recently added. And then how to stay updated going forward, because as you know, things are changing on a daily basis. But for the second 45 minutes, we'll be able to do some more collaboration. So we're going to be focusing on your questions and trying to answer them as best as we can as panelists today. And certainly other people might chime in and offer resources as well as we get into that second half. The first thing that I really want to cover is, many of you have seen this. The Office for Civil Rights at the U.S. Department of Health and Human Services issued an announcement, and they basically said, you know what, healthcare professionals who are acting in good faith during this emergency experience that we're having with this pandemic, we will sort of not enforce the requirement that technology be HIPAA compliant. If it's an emergency, if people are acting in good faith, etc. That being said, I strongly recommend that you use HIPAA compliant technology in spite of that announcement that came out for several reasons. One is, when you really look at their announcement, what they're basically saying is, if you have no other alternative and it's emergency and you're in a pinch, then fine. We're just going to look the other way. It doesn't change the law, and it doesn't affect any state laws nor the ethical and clinical considerations for making sure that you're using secure technologies when you're working with your clients and trying to safeguard their confidentiality. The fact is, we do have a free option available to us that is HIPAA compliant, and so I see no reason to be using FaceTime or the non-HIPAA version of Skype or other electronic resources at this time. An example of a free resource is Doxy, which can be accessed at doxy.me. And we'll be talking some more about some other platforms and options later on as well. But additionally, this is a temporary measure that they've issued to sort of give people time to get the appropriate technologies in place. Now, I'm no epidemiologist. I have no idea what's going to happen with this pandemic. But what I keep hearing over and over again is that we're 12 to 16 months away from a vaccination. And I also have heard that there are theories that maybe this will end up being a virus that is seasonal and it will sort of die out, but those are just speculation. We really don't know what's going to happen. And I think we should be thinking more long-term right now. We should be prepared for a more long-term period of social distancing, possibly until a vaccination is readily available to the general public. We will still be practicing important safeguards. And so along that line, I'd encourage you to go ahead and get the infrastructure in place to think a little bit more long haul with this and look at your HIPAA compliant technologies. Now, the 491 board issued an emergency rule that deals with registered interns. Now, originally, we had reached out to the 491 board's executive director, and they have been very responsive to us. They've been very good about communicating with us. And we asked for a few things. We asked that the board consider some kind of an emergency rule or something that would change some of the requirements involving interns. The first thing that we asked for was that interns, because I know originally, interns could not do group supervision through webcam, and they could only do up to 50% of their individual supervision sessions through webcam. But if you're social distancing or you're under a quarantine of some kind, that's not going to work very well for you as an intern. During this pandemic and during the period of social distancing, it'd be best to not be meeting in person, especially not in groups, but maybe even one-on-one would be another unnecessary possible exposure risk. So we asked that maybe there be flexibility temporarily so that interns could attend all supervision sessions through webcam temporarily. We also asked that for clarification that interns could use their telehealth therapy hours towards their 1,500-hour face-to-face psychotherapy requirement. The board met and they did allow for supervision hours to be temporarily conducted through webcam. And they also allowed registered interns to count their telehealth therapy hours towards their 1,500 hours of face-to-face therapy, but they added a few qualifiers. One of them is, of course, that the intern has to have a qualified supervisor, and that certainly makes sense. Every intern should have a qualified supervisor if they're providing services, especially. The second is that the intern has to have a telehealth protocol and safety plan, also very sensible. The third, though, is that the therapeutic relationship with the client has to have started prior to March 19th. Okay. So this is a provision that we did not ask for from the 491 board. And, you know, I'll tell you, I know many of you are very concerned about this provision. We've received numerous phone calls and emails from you, as well as our central office. And I'll tell you my personal opinion is I am concerned about this third component because I know that many community mental health centers rely predominantly, and some even almost exclusively, on the services of registered interns. And these community mental health centers primarily serve, quite honestly, underserved populations, people of lower socioeconomic status, for example, Medicaid recipients. And my concern is that if interns are not allowed to start a new counseling relationship through telehealth, then the unintended consequence will be that some of the underserved Floridians will not have access to therapy during a very difficult time in which therapy might be all the more important. So we'll see, things are changing constantly. My understanding is that there's been some communication with the Surgeon General's office and also I think with the state attorney's office. And so we'll see what happens. But as of right now, that is what the emergency rule states from my understanding. The final component, also something that we didn't ask for, but it was something that the 491 board's hands were probably tied on. If you're a mental health or a registered mental health counselor intern and you're working in a private practice setting, as you know, there is a Florida statute that says that a licensed mental health professional must be on the premises when you're providing clinical services. Well, we asked for clarification. If a registered intern is providing telehealth, then do they really need to have a qualified supervisor literally in the same, or a licensed mental health professional literally in the same building as the intern while they're providing that service? Does that really make sense at this time? The issue, as I understand it, is the 491 board does not have the power to change statutes. And the Florida statute says what it says. Maybe, there could be guidance from another entity on what that statute means, but that's not the 491 board's role to be able to provide that guidance or interpretation of that statute, from what I understand. So my personal hope is that we will see that this gets clarified and addressed, and at least temporarily, that registered interns would be able to provide telehealth to their clients, even if a licensed mental health professional is not physically in the building with them, but is accessible to them. And that's the part that I think is very important. So,
Erin,
yes.
I think the Attorney General's office has to make that decision to waive that.
All right, so hopefully we'll see something come from the Attorney General's office in the near future. Thank you. Speaking of which, I know some of you have been quite active in ensuring that folks know that you're not happy about some of those aspects of the emergency rule. And here's a letter that recently came into my possession that a senator wrote to the Surgeon General's office asking for there to be some more flexibility with the interns. So we'll see. We'll move on to Executive Order number 20-72. This is a state executive order. And this was brought to our attention by our members who asked the question of, does this executive order prohibit licensed mental health professionals from providing in-person therapy with clients at this time? If you read the executive order, my way of interpreting it was, they're saying that to conserve our resources in healthcare, for example, surgical materials and that sort of thing, healthcare professionals should only be providing services that are medically necessary at this time, rather than elective surgeries. Like, for example, maybe a plastic surgery that's purely cosmetic and isn't medically necessary at this time. That's the way I read it, but others interpreted it to mean that therapy might not be able to be provided. So we sought clarification from the 491 board, which again was very responsive to us and very rapidly replied to us. And essentially, in their response, the executive director's response, she said that only you as the licensed healthcare professional can determine how to safely continue to see clients during this time. And she also added that at this point, there have been no broad prohibitions for discontinuance of any type of healthcare in person. So my interpretation would be, if you think that what you're doing is medically necessary, and you don't have a telehealth option for some reason, and you're willing to take appropriate precautions, there's no blanket prohibition that says you cannot meet with a client in person at this time. Now, a separate question of whether that's a good idea, but we'll get to that in a moment. Another question that has been asked of us during this pandemic, are we considered essential workers? Because, as you know, there are various quarantines, safer at home rules that have been ordered, executive rules. So anytime that there's some kind of an order that says people need to stay in their homes, except for a few exceptions, one of which being if they are an essential worker, that begs the question on whether we are or not. Well, the U.S. Department of Homeland Security provides guidance on this issue. And if you look under their healthcare and public health essential worker exception, they list caregivers and they cite psychologists, mid-level practitioners, social workers, and community mental health as exceptions, as examples of essential workers. The common interpretation has been that licensed mental professionals are essential workers. Now, if we look at the governor's executive order just issued yesterday, and that I believe goes into effect today, they do say that they use the same standards as the U.S. Department of Homeland Security when determining what an essential service is. If you look, then you have local resolutions to pay attention to, and here are 3 examples. Pinellas County specifically lists healthcare providers such as mental health professionals, therapists, and substance abuse providers as being essential workers. Hillsborough County says they use the same list as the Department of Homeland Security, which we showed you on the previous slide. And Orange County, the Orlando area, their emergency order also provides an exception for healthcare providers such as mental health professionals, psychiatrists, and therapists. So the interpretation is that we are considered essential workers. Some people have said, well, some of my clients who are essential workers, they have some kind of a letter that says that. So if they were pulled over or stopped by law enforcement, for example, they could show that they are an essential worker. My thought has been, I figured they give us these little cards for a reason when we renew our license, that we could carry in a wallet or something that shows that we're a licensed mental health professional. And if I were to get stopped or pulled over by law enforcement and I was performing an essential duty connected to my profession, like going to my office, then I would probably show them this to document that I am a licensed mental health professional. For those of you who are SAPs, substance abuse professionals who conduct DOT evaluations, you may know that federal code requires that your evaluations be conducted face-to-face and in person, and they do not accept electronic evaluations done through webcam or other telehealth sorts of platforms. Unfortunately, that remains true, according to an email recently from American substance abuse professionals. And then to further complicate matters, the Department of Transportation recently sent out some additional clarification that's kind of vague, and it basically kind of says nothing's really changed for SAPs, but follow the directions as you comply with federal code, follow directions from your state and local officials, which I interpret it as take necessary precautions if you're going to be conducting evaluations at this time. If you are providing services in your office, which it appears is about 29% of you, because 46% of you said you're doing telehealth only, 15% said you're doing in-person only, 14% said you're doing a combination of in-person and telehealth, and 26% of you said you're not even meeting with clients at all right now. So for those of you who are meeting in person with clients, here are some examples of office precautions. Now this is an individual practitioner choice. I'm not going to tell you whether you should be meeting with clients in person or not right now. In my opinion, it is best to avoid meeting with a client in person right now and to minimize in-person meetings to reduce the possibility of exposure. But as long as you're meeting with clients in person, and I still am, by the way, then I think there are some very helpful precautions that you can take as directed by the CDC and the World Health Organization and other authorities. Again, transition as many clients as possible to telehealth to reduce that in-person contact. You could allow only one client in the building at a time. You can make hand sanitizer available to clients when they enter and just before they leave and have them sanitize before and after. You can sanitize all commonly used surfaces in between each client, perhaps while wearing disposable gloves that you appropriately discard. You can keep all chairs more than 6 feet apart, and you can never come closer than 6 feet to a client. Of course, that means never shaking hands with a client, touching a client, or for that matter, handling anything that the client has touched or will touch. You can remove all your magazines from your waiting room, any unnecessary materials that somebody could handle and then somebody else could be handling shortly thereafter. And you can also replace all office paperwork with online forms. Think about taking all these precautions, but then a client hands you their paperwork, like a release form or an intake packet, and you take that from them in your hands. Now paperwork is going back and forth. How do you get the virus? Well, you get it through droplet exposure. So if a client sneezes or coughs, and then droplets either go into the air and are taken into your system, or that's why we have the 6-foot rule, because droplets will tend to settle to a surface within 6 feet of the individual who expels them. The other way that you can get it is that a client coughs or sneezes and then droplets end up on a surface, which you then handle and then somehow get into your system, such as by touching your face. So if you're not handling things that the client's handled, and you're not coming in within 6 feet of a client, we would think that your exposure risk would be dramatically reduced. You can have your office staff work remotely if possible. Clients could maybe move towards online scheduling. They could do scheduling over the phone, or they could do scheduling while they're in the room with the therapist, But if you have like a central office and clients line up to check out or in or that sort of thing, well, now we've got congestion unnecessary handling of items and exposure. They're handing money to somebody, they're handing a check to somebody, or giving somebody their card to swipe. All of those things involve touching and handling things that other people have handled or touched. And a lot of it can be, all of it really could be automated. You can wash your hands every hour, even if you haven't touched anything that you think anybody else has touched and you're not touching a client or coming in within 6 feet. You could just get into the habit to be extra precautious of washing your hands thoroughly every hour as another safety measure. If your hand touches a communal surface, just sort of presume it to be potentially contaminated and clean it as quickly as possible. You could also check and track your body temperature daily. I check mine twice a day and I log it so that I can see any change over time. And you can practice social distancing outside of work because the less contact outside of work, the lower the probability that you will contract the virus and then potentially spread it to others. You can put a signage on the outside of your building indicating that clients should never enter the building if they've experienced fever, cough, or shortness of breath. And instead, they should call their physician and then call your office to discuss telehealth options. I would recommend for a period of time being more flexible with late cancellation fees and things, because you'd rather have a client call you the day of their appointment and say, you know what, I'm experiencing some symptoms, than to say, I don't want to do that because I don't want to end up paying an unnecessary cancellation fee or something along those lines. So now we'll move into transitioning to telehealth. The first thing is obviously making sure that you have an appropriate platform. I mentioned before that regardless of that announcement from DHHS, I would still recommend that you get a HIPAA compliant appropriate technology in place quickly for telehealth. Some examples are Doxy. By the way, we will get you a copy of all of the slides from today's webinar, and everything that you see that's underlined here in sort of lighter green, that's a hyperlink. So when you get the PDF, you can click on any hyperlink and be redirected to a website to give you additional information. So we have Doxy as one resource. Doxy has two plans. They have a basic plan, which is free. They have a pro plan, which is $35 a month. The pro plan benefits include the ability to do group sessions anywhere from 2 to 10 clients in a group room with a therapist. You can't get that with the basic plan. You also get better support services, and my understanding is better bandwidth, I mean. So you'll see fewer connectivity problems and that sort of thing if you get the pro plan at $35 a month. Another option is Zoom for Healthcare. There's some benefits and drawbacks to Zoom for Healthcare, which I personally use. If you're a single practitioner, it at first does not look very affordable, because if you go to their website, you'll see that their lowest priced plan is $200 a month, and then that plan gives you up to 10 licenses. If you're a single practitioner by yourself, you don't want to spend $200 a month so you can have 9 licenses that you're not going to be using. What you can do is contact Zoom directly, either through their online chat or by calling them up, or maybe through email as well. I haven't tried that way, and you can tell them, look, I'm a solo practitioner. I don't need 10 licenses. I have had colleagues who have been able to get a plan with up to 5 licenses at $100 a month. Can I qualify for that? So far, every clinician I've ever spoken to, including myself, has been able to get them to provide the plan at $100 a month with up to 5 licenses. So let's say you work in a small group practice, you maybe have 3 or 4 therapists. That might be a great option, an expense to split between you. Or even if you're completely by yourself and you just really want Zoom versus Doxy, then you're looking at $100 a month, and then you have 4 licenses you don't really need. So that's Zoom for Healthcare, and I've never heard of anybody being able to get it for less than $100 a month to date. The regular free Zoom plan is not HIPAA compliant. It has to be Zoom for Healthcare. You got to get a business associate agreement signed in order for you to be compliant. Gotomeeting does have a HIPAA compliant version. I do not know anything about the costs for it. The regular Gotomeeting plan will not suffice because it is not HIPAA compliant. G Suite, same thing. They do have a HIPAA compliant version. I know nothing about the cost, but there's a link that you can go to visit it. If you use Simple Practice, which is a electronic practice management system, they also have telehealth available. If you use therapy sites for your website, they have telehealth available. And I just got an announcement from them yesterday that all therapy sites customers are getting a temporary free telehealth plan if they apply for it during this pandemic. So that's brand new, hot off the presses, and I'll show you, we can get information on that soon. And then VC is another option that people are commonly using. You can't just get a platform. Your clients need to know how to use that platform, and they need to have appropriate informed consent. They need to understand the potential benefits and drawbacks. They need to know about things like the importance of being alone, having confidentiality in the environment they're in. What happens if they no longer have internet connection? How do they reach you if they need to reach you during this time? You might be working centrally in a home office or something. How do they reach you if they need to? These are all considerations, so it's very important that you get appropriately trained on telehealth. You can't just jump in there and do it. I always recommend reading section B6 of the brand new OMCA Code of Ethics just released this year to get more information about ethical considerations for telehealth, and also read section E of OMCA's standards for the practice of clinical mental health counseling, which is about competencies for conducting telehealth appointments. And both of those are free on OMCA's website. And then complete a telehealth training program, and you'll get more information on how you can find those programs at the end of this webinar. Now then comes the issue of insurance, and that's become a very sticky issue because the issue is just because your client has insurance doesn't mean they have telehealth coverage. That's the first problem. And then the second problem is, how does that insurer want you to bill for telehealth even if they do cover it? And there are going to be some variations there. What I can tell you is the consensus seems to be across the board that you need to change your location code from code 11, which denotes an in-office appointment, to code 02, which denotes a telehealth setting. The second thing is that you would use the same CPT codes generally as you would use if you were seeing the client in person, like a 90791, 90834, 90837, etc. But you add a modifier at the end, and here's where things get a little bit sticky. That modifier is either going to be GT or it's going to be 95. I wish there was a magic rule that would let you know which insurers want which modifier, but that doesn't exist. I have seen evidence that United / Optum wants GT. Some others want 95. If you look at Simple Practices blog, they say 95 is generally what commercial insurers want, and GT is generally for Medicare, which contradicts United's email. The American Academy of Pediatricians says use GT only when you're directed by your payer to not use 95, so default to 95. Both modifiers denote, though, audio and visual contact, like Zoom, for example, or Doxy. Most insurers do not cover telehealth, which are telephone appointments, which is audio only. So that's why it's important to be using webcam technologies and not doing phone sessions. You can't bill with a modifier of 95 or GT legally if you're just doing a phone session and you cannot see and hear your client, and vice versa. If you don't follow these things, if you say that you did an in-person appointment when you didn't, or you say that you used video and audio, but it was really only audio, understand that you were putting your license in risk. You could be charged for insurance fraud, and there are plenty of cases of people getting into trouble for those types of behaviors. Now, what if your client crosses state lines? That gets a little bit sticky too, because counselors have to follow the laws that govern the counselor's license and the laws that govern the location the client is currently in. And that makes things a bit challenging because do you know the law both where you're at and the law where the client physically is at? Because if the client is in the state of Georgia and you're licensed in Florida, even though you're not physically in Georgia, you are now providing healthcare to somebody in their jurisdiction. So you must follow their laws and rules as well as those in the state that you are currently in. That's also laid out in our OMCA Code of Ethics. Fortunately, there is a resource that makes this a bit easier, and that resource is a free telehealth. Oh, we got a new announcement that just came in. Aetna is paying for telehealth. They've suspended co-pays for patients, but it doesn't tell us whether they want 95 or GT as a modifier, huh? All right, things are constantly changing. So I will show you where we're posting these updates about each insurance company later on, though, to help you out. Now, there is a free telemental health app that gives you information about the laws in other states. Let me see how we're doing with time, because if we have time, I'm actually going to show you. I'll probably not show you unless we have time in the questions section. I'll actually pull the app up and show you how to use it, because it is a bit tricky at first. But you can go into that app. You can choose any state, like Georgia, for example. Then you can click that you are a counselor, and you can read what the law is or is not in Georgia about doing telehealth across state lines, if they even have any guidance on that. And some states don't really have a law or a rule yet that governs telehealth, making things all the more confusing. But this free app is available for you to download, and I recommend using it. It's a great resource. Next, how do you move to electronic forms? Well, there are a lot of ways to do it. I contacted SurveyMonkey, and they told me, you want a HIPAA-compliant SurveyMonkey plan? $10,000 a year minimum. Of course, I'm not doing that. That's not affordable for a counselor. Fortunately, I found another resource called JotForm. JotForm has a HIPAA-compliant plan version that you can use to easily and quickly build electronic forms, or to use other people's electronic forms and accept them as templates and modify them accordingly. Now, originally the HIPAA-compliant plan was about $35 a month. But the good news is they recently announced that their coronavirus responder program, this program gives a HIPAA-compliant version of their membership plan for free to any healthcare professional involved in COVID-19 response. All you have to do is fill out a quick online form, and you explain how you using their resource is going to benefit people during this pandemic. So I basically could go in there and just say, I need to get rid of paper forms to reduce transmission while still being able to provide medically necessary psychotherapy to clients during the pandemic. And boom, that's all it really takes. And you get a free HIPAA-compliant plan. Counselors can build forms and tools, even therapy, homework assignments, and share them with each other and collaborate on things. So I created an intake packet form, for example, that you see on the left-hand side of the screen. I have a daily mood chart that my clients can complete every single day while they're social distancing, and it sends me their entries, and then we can discuss them during our sessions. They can even send an agenda for things they want to talk about in their next counseling appointment. And I have the mother of all thought records. It is like a 23 exercise thought record that clients can use anytime they're having an emotionally activating experience in between appointments. And then it sends that thought record to me so that in our next session, we can review their thought records. And I found that many clients are very much appreciating having things that they can do at home between appointments when they're feeling increases in anxiety, depression, stress, fear, etc. Now, because of the issue with these insurers, FONCA did write an open letter to all of Florida's insurers saying, look, we really want you to make it so that all of your customers, at least temporarily, have access to telehealth for psychotherapy. And you should be clear with therapists on how they need to bill to get appropriately reimbursed, and send out a communication to all of your behavioral health care providers to that effect. Now we have to get this distributed to all these insurance companies, and we're working on that, and you can help with that too. You can send this letter out to insurers as well, and we are really calling on them and making the point that when all the dust settles, Florida citizens are going to look at their insurance companies and ask, who did a good job during this pandemic? Who took care of us and who didn't? Transitioning to telehealth, Dr. Eric Beeson, the president of AMCA, wrote a similar letter to a National Association of Health Insurers calling on them to do very similar things. And that's another letter that can be sent around. Now, some of you are noticing, I was surprised to hear that 26% of you aren't even seeing clients at all, whether through telehealth or in person. And unfortunately, I'm going to guess that's higher than usual because of the pandemic. You might want to consider platforms that clients go to because they want telehealth and telehealth only, and consider joining some of those platforms like MD Live, Live Health, Teledoc, MeMD, OpenPath, Talkspace, etc. Problem is, I don't know how long it would take you to become approved as a provider for some of these platforms. So that would be something to consider and to maybe get started on now, because again, I'm encouraging people to think a little bit more long haul. If you're still filling your calendar, and no need to do something like that, but if you're struggling to make ends meet right now, that might be something to consider. Keep in mind that some clients are not going to be appropriate for telehealth. Some do not have internet access. Some struggle to use technology because of cognitive impairments or other issues. Some don't trust telehealth. They feel uncomfortable with it. They don't have the appropriate equipment. They may lack privacy. If you have a client, for example, who's in an abusive relationship and the person she's with doesn't even know that she's seeing a therapist, it's going to be very hard, obviously, for somebody like that to do telehealth appointments at home. Some clients are not very tech savvy, and some do not have telehealth insurance benefits. I've discovered that already with some of my clients. And that's why I'm still meeting with a minority of clients in person, although I try to avoid it. Providing clients with guidance through this pandemic, an interesting thing is, what if a client has OCD? What if they've had germophobia, for example, and they've been doing exposure therapy to try and get some relief with their OCD? They could have their condition exacerbated during this time. The same thing with clients with anxiety disorders. The International OCD Foundation provides a great resource, a whole page of resources for clients with OCD that helps them during this pandemic to take appropriate precautions. Those are authoritative and recommended by sources such as the CDC and the World Health Organization, while avoiding things that are not going to be helpful and are more manifestations of the OCD. Keep in mind and be working with your clients on the motto that social distancing isn't social isolation. Many clients are coming with very creative ways to connect with important people in their life. They might be living in the same household as others, family members and so forth, and might actually be spending more quality time, although taking appropriate precautions even in their own household. Clients are doing interesting and creative and innovative things. A couple I worked with that likes to go to movie theaters together, and they've been trying to have more date nights. Can't go to movie theaters right now. So they got virtual reality headsets for $130 each, and they go into a virtual movie theater and they sit down together and they watch a movie. They can even invite friends and have a double date and come to the movie theater together in a group and say hi to all their avatars in the room. So it's kind of interesting what clients are doing to still be able to connect socially to each other during this difficult time. No gyms does not mean no exercise. Clients can Google keyword searches like hotel room workout, the art of a full body workout without needing any equipment other than common household items. And also, even under the new executive order, clients can still go outside to exercise as long as they're practicing social distancing and as long as they're in an appropriate place. So they can't get close to other people, they can't be in groups of people, but they could go for a walk, take their dog for a walk, go jogging or running if they're in an appropriate location to do that. And of course, they'll want to avoid touching any communal surfaces outside, and probably a good idea to be washing very thoroughly when they return home, etc. Quarantine can be a personal renaissance. I've had clients tell me things like a client tell me, my girlfriend got me an art kit for Christmas. I've been so busy, I haven't gotten around to it. So for the first time, I'm opening that art kit and I'm getting around to it. Had a client said, I'm finally getting to that book list that I can never get around to, and I'm doing my reading. Had a client who he has to travel for work so much, he's always on the road. But now that he can't do that, he went and got a paddle board, and he's paddle boarding along the coastline, far away from other human beings, and getting a good upper body workout while enjoying the scenery. So there are ways that people are actually reconnecting to very important and meaningful activities. It's important that clients know that telehealth is better than no help. Even those who are uncomfortable with the technology, maybe we could work with them and actually make that a therapeutic goal for them to learn how to use some of those resources. Some clients are struggling with job loss. While some jobs are receding, such as being a server in a restaurant or a bartender, others are expanding, like retail jobs, delivery jobs, etc. Although again, some of those jobs involve the potential for extra exposure, so that's something to consider. And I've been recommending to clients who lack structure and are becoming bored, irritated, self-deprecating, losing some momentum and motivation, etc., that each day they get into a practice where they develop a plan for the day. And they should put something on the schedule that's relaxing, something that's productive, or maybe a few things that are productive, something that's social, but still respects social distancing, something that's entertaining, and something that is meaningful. And that's just a little exercise I've been doing with clients that they found helpful to create a sense of structure and a new normalcy during a time of upheaval. Now let's cover how you stay updated, and then we'll be going into some question time here. The first thing I suggest is the OMCA member forum. I'm going to pull out of my slideshow here for a moment, and I'm going to go into my Safari browser, and I'm going to show you how you can get constantly updated on all things related to COVID-19. As soon as we know about it, you can know about it. I'm going to go and log in because you do have to be a member of FOMCA to access the member forum. But once you log in, you will see under membership, member forum. Click on that. And hopefully, by the way, you guys can see my screen right now. If you can't, let me know, please, but I think you can see it. We go here. This is a thread I would recommend, COVID-19 resources for counselors, but you can see there's tons of COVID-19 threads. Here's one for COVID-19 and insurance reimbursements. Every time we get an update from an insurance company, we post it and we give you the original source. So it's not just people's opinions or interpretations, but you can read the original source itself for what these various insurers are saying about providing telehealth. And if you get a communication from an insurance company that sheds some light on how to get reimbursed, please go into this forum and post it. Try to post the original source also so that everyone else can benefit from what you have seen. COVID-19 resources for counselors. Since the very beginning of this pandemic, or maybe not the very beginning, but for a while, we've been posting constant updates on new resources, all kinds of things. If there's a free telehealth training being offered, you'll know about it because it'll be posted in these resources. If there is a new executive order or how to apply for a small business loan or to get some financial relief if you're losing clientele during the pandemic, you can get, here's PESI's free anxiety worksheets for people who are social distancing, stuff from Simple Practice. Do malpractice insurance policies cover telehealth? There's just so much information in here that will help you to navigate through this difficult time, all the way down to our original post here, which was on March 15th. And we're updating it every couple or few days with new resources and information as it comes out. So, one more thing about that. If you go to the forum, make sure that you subscribe to the forum. I'm gonna go back to the forum here. I'm gonna show you something. See this green check right here? If you don't see that, you are not subscribed. You should subscribe. And the reason why is, if you're like me, your email inbox is inundated right now with COVID-19 related information. If you subscribe, you will get no more than one email in a 24-hour period that will show you the digest version of all the posts in the COVID-19 or in the forums for FOMCA for the past 24 hours. And if you want to read, you can click on any of them and read more. I'll show you. I'm going to unsubscribe, and this is what it would look like if you're not subscribed. So just click subscribe to forum, and there you go. All right. So I believe next thing is, if you have questions we don't get to today, feel free to send me an email or contact our FOMCA office, and we'll try to connect you, whether you're trying to become a member, you're trying to access the forum, or whatever the case might be. And now we are ready for questions and answers.
And can I add one more resource, Erin? The Florida Mental Health Professions.gov. That's the website for the board, and they have updated stuff on there all the time. And there's actually a box on the front page that if you check it, they will send you updated information to your email if you register with that.
Thank you for sharing that, because that is an important resource. I should have added it to the slide here, Florida's Mental Health Professionals.gov. And is it resources that folks would go to sign up for those announcements?
Down at the bottom, that you go down to the bottom of the front page.
Okay, the latest news here.
Latest news.
Okay.
Is that? Yeah, it is. But there's here it is, subscribe. Go up to enter email subscribe. I don't know if you see.
There we go.
Yeah, that's where you do it. And they'll send you updates.
Florida's mentalhealthprofessionals.gov. Subscribe. Believe it or not, I embarrassingly have not been subscribed. So I'm going to do it right now.
Good.
All right. So, Laura, do we have questions to get to?
Yes, we do. Okay, so I'll start with the first one. I am confused about House Bill 23 in Chapter 2019-137. Are we allowed to provide counseling via phone call?
Are
Top
you a
of my head,
registered intern or a licensed professional counselor? Are you a LMHC or it depends.
Let me see if I can ask.
So, Dr. Denny, let's say that they were a licensed mental health professional. Do you know then would they be permitted to do telephone sessions?
Yeah. Yeah,
Now,
LMHCs are, yes.
another question that's come up is the we know that registered interns cannot, traditionally, they have not been able to use, prior to this pandemic, they haven't been able to use telehealth appointments towards their 1,500 hours of face-to-face psychotherapy.
Yes.
But many people pointed out that doesn't technically mean that they can't do it. It just means they can't use it towards their 1,500 hours of face-to-face psychotherapy. Do you know if there's any interpretation of that?
I was reading about that under the Rule 64B ER 2020, and it talked about that. I underlined it. The rule currently does not allow face-to-face psychotherapy by electronic methods with clients for registered interns. So, it says the rule also limits the number of face-to-face. So with that ruling, it looks like the registered interns were not supposed to be online with their clients. And I can't say regardless of the 1,500 hours or not, the way I'm reading it is they're not supposed to.
Okay.
Yeah.
Thank you for that clarification. Of course, now though, during the pandemic, there's a temporary emergency rule that would enable them to, provided that the relationship started prior to March 19th, correct?
At this point, yes.
Okay. Next question is there any update to the provision that registered interns cannot provide services to clients with whom they don't have pre-existing relationships prior to March 19th, 2020?
Not at this time.
Okay. Heard that Doxy is crashing a lot. Just thought you should know. I use Simple Practice, but of course that involves a cost. That was just
I do have something to say about that. We have gotten reports about Doxy crashing, especially at the beginning when they were being inundated with new customers. However, we also have heard many people say that are pro subscribers that they never experienced that it was only the free subscribers who were having that problem. And the free subscribers told us that the problem seems to have stopped. So I don't know if it's still going on for people, but the pro plan might be one way to reduce the likelihood of those service interruptions, which is $35 a month.
Okay, next. Oh, sorry, Dr. Denny, were you going to say something?
I was going to say also VC has, it goes in and out of temporarily. They said right now we can't add you, and I think they're acclimating as well. Taking new ones. Mm-hmm.
I've been doing very well with Zoom for healthcare. I use it every day, and I haven't run into connection problems with that resource. So that one's been panning out pretty well.
Good.
Okay, next up we have this is great, think long term. However, graduate students are now being allowed to complete hours to graduate. What is being done for that? I am a graduate. I am to graduate in August, and I cannot do direct hours because of social distancing. Is AMCA looking into that?
Well, this is a good question you brought up. And actually, we did receive an email from that Troy University sent out to its KCREP students that is posted on the member forum. And according to this email, they've said that under certain conditions, students can provide can count telehealth appointments towards practicum and supervision hours for KCREP purposes. Now,
Nice.
of course, you have to look at in your state, is that okay or not? But according to KCREP, according to this letter anyway, which I think was posted in one of the most recent updates here. See if I can pull it up. Oh, there it is. An email from Troy University 2 posts ago might answer a popular question. Can counseling students in KCREP accredited programs get practicum and internship hours? So you can click there to read that information.
Good.
Okay. All right. Next up, we have the provision about the starting of therapeutic relationship has significantly hurt my private practice as a registered intern.
Say that again.
The provision about the starting of a therapeutic relationship has significantly hurt my private practice as a registered intern.
It's a comment rather than a question.
More of a comment rather than a question. Yeah, we've already touched on this point, and we know that everyone's working hard on it.
Yeah.
Sadly,
yeah, the board is aware of it too.
Even though the hours would not count towards licensure, are we registered interns allowed to provide teletherapy to new clients?
So that we were just talking about that also, and I guess that's a matter of interpretation. But Dr. Denny did share. You can correct me if I'm wrong, Dr. Denny, but the way you read it, it really implies that no, except for right now during this emergency rule. But outside of this emergency rule, the answer would be no.
Yes.
So that emergency rule, it's a 90-day rule that's been in place for about a week now. Is that right?
Correct.
Okay.
Okay, I have another comment here. I'm in California, and we were today recommended to wear a mask. Everyone, just something to consider.
A CDC has been hesitant to recommend masks because it gives people a false sense of extra safety, to which they sometimes take fewer precautions, and because there's not a lot of good research yet on the efficacy of the masks, and because people use them improperly by either not sealing them correctly and or contaminating the mask and then wearing the mask where the contaminants actually get into your system more. So I would add, if somebody were going to be using a mask, it would be important for them to be appropriately trained and to be using appropriate tools and resources for it. But I have not seen a recommendation from the CDC or WHO that that in general that people wear these masks yet.
Actually, they stated that you touch your face 20 times more than you would without a mask because of adjusting it or moving it or whatever.
Yeah, it's a controversial topic, so I wouldn't go so far as to recommend that people start doing it. A client I have who is a nurse practitioner said that he saw an individual pull out their wallet, which was in the same pocket as their mask. The mask fell on the floor, and then they put it on. So that mask has touched their wallet, which they're handing stuff over to people, and touched the ground, and et cetera. And now they're breathing in whatever's on that mask. So that's an example of how that could get you into trouble.
Okay, next question we have is, do you know if services performed traditionally in the school, counseling with IEPs, for example, would require the platform to be HIPAA compliant versus the basic plans?
My first thought about that would be, you look at the definition of who is a HIPAA regulated entity, because there are only certain, I'm not a school counselor, but I don't think school counselors are HIPAA regulated entities. So you'd have to go back to that federal definition probably. Now, would it still be wise to use a HIPAA regulated platform is another question.
Yeah.
Great question for the American School Counselors Association.
It is.
Okay. What does the reimbursement difference look like typically? That's all I've
I've
got.
heard rumor that telehealth reimburses less. I've heard reports that it doesn't. And I have not yet gotten any of my claims returned yet for telehealth, so I don't know the answer. If somebody does know the answer and they have an authoritative resource they could share with us, then please type that into the questions box and or consider posting it on the forum.
Okay. Is FaceTime a compliant platform?
FaceTime is not HIPAA compliant. Well, let me backtrack a little bit. If you Google it, you will see various attorneys argue that it is and some arguing that it is not, using very complex legal and technological arguments. All I can tell you is that the US Department of Health and Human Services, in their announcement, gave FaceTime as an example of a non-HIPAA compliant platform themselves. So that should tell you it's not HIPAA compliant, in my opinion.
I agree.
Okay. Does it only matter where the client is located? For example, if I'm licensed in Florida but physically located in another state while talking to a client who is physically located in Florida, does that matter?
In my opinion, yes, because you have to follow the laws in both states. If you're in a different state, you're now in their territory, providing healthcare, even if you're crossing state lines and providing it to somebody else. When you're physically in another state that you're not licensed in, or when your client is physically in another state that you're not licensed in my opinion, you would have to be knowledgeable of the laws of both states.
Yeah, and if they are in another state, let's say you're licensed in Florida and you're staying up in North Carolina for 6 months and you want to continue to treat your clients in Florida, you can apply for that with the board, outside of state, in state, outstate and in state. Well, wait a minute. If they're licensed in Florida, though, they're not allowed to be licensed in Florida doing that. That's right. I'm sorry. I take that back, because you cannot be licensed in the state of Florida to register to treat clients in Florida if you're out of state. You can't be licensed in Florida or live in Florida.
I can tell you, when I was going through that Telemental Health Laws app, I saw some states say stuff like, you know what, if you want to be in our state and provide services to someone in the state you're licensed in, we're okay with that for a period up to 30 days. Or there's just weird exceptions and rules.
Yeah.
Bottom line is you have to look at the laws and rules of both states.
Yeah, you really do. You really do. But the people outside of the state of Florida who have licenses that are clear can register with our board to treat people within the state of Florida. But the restriction is they can't be licensed in Florida and they can't live in Florida if they go through that medium of being allowed to treat clients in Florida. We're trying to be an example to other states.
Okay. Next question up is there a way to find out if the insurer covers telehealth services so that we don't bill the insurer and then get a surprise that we are offering the service for free now because they are not covering it?
For me, I have recommended two things. Number one, part of my informed consent and my instructions for clients is if you want to do telehealth, then you should contact your insurer and verify that you have telehealth benefits. Number two, in my practice, I have asked our office staff to contact each insurance company to see if they can get an answer on what the current status is of telehealth for their insurers. Usually the answer is it depends on the plan. So you could, just like you might verify a client's insurance benefits up front when you first see them, you might contact the insurer and say, for this individual's plan, is telehealth covered for psychotherapy? And get that, and then document that phone communication with that insurer. So those are two strategies I think that you can use. Oh, and then when you contact the insurance company, find out which modifier they want to see at the end of the CPT code, 95 or GT.
Okay. I was under the impression that Medicare is covering telephone sessions. I have clients that prefer only audio, no video. So as long as it's documented as so, is that covered?
My first answer to that is I don't know, because I haven't been paying attention to Medicare because I'm a counselor and I can't bill Medicare, unfortunately. So but I have seen some announcements about Medicare allowing telephone sessions. I do not know, though, what the specific details are, unfortunately.
Okay. Is there a cost to be a member of FOMCA? So I can answer that question, actually. Yes, the cost is $65 for the yearly membership for licensed clinicians and $55 for registered interns and $25 for students. So we encourage you to join and support us so that we can continue to do this through these difficult times. Okay,
You know, while on that note, Laura, there is a free telehealth webinar that we're providing next week with a nationally renowned expert on telemental health, Dr. Susan Mayerly. And that's an example of, we're constantly going to be putting out resources for you during this difficult time. That's another value. When you look at the annual membership rate, and then you look at what you're getting for that rate, I think you'll find it worth it, as I have anyway.
Me too.
Absolutely. So we encourage everyone to join the webinar and register for it. You can do so by visiting our website, www.fmhca.org. Alrighty, next question up. How do you demonstrate knowledge of laws and rules if you are providing telehealth in another state? You do not need a license in that state.
Well, you know, again, I would say, I mean, the premise of the question isn't necessarily true. In some states, you do have to have a license in that state to provide telehealth to individuals physically in that state. And in some states, you don't, but you might have a registration process, or you might have a restriction on how long you can provide those services for. So ultimately, you should use the Telemental Health app to look at the laws and rules of that state and then determine that you're meeting the requirements of that specific state.
Okay.
Yeah, every state is different.
Okay. If we are doing telehealth via phone only because the client doesn't have access to the internet or doesn't have right equipment temporarily during this time, is there something we need to document in our notes to explain this, or why we didn't use Doxy, Me, or another platform?
Well, I have an opinion about that. Dr. Denny, do you have one that you'd like to share?
Well, if you're an LMHC and you're providing a telephone session, it depends. Is this for insurance purposes, or is it just for documentation purposes? Because you can document phone session and write your clinical note. If it's an insurance company and they have other criteria required, then you would have to converse with them and see what they need. But you can do phone sessions and document them just like any other note.
Yeah, my thought is, if you're in, I might have, because I was a little distracted because I was pulling up this app for you guys, but if the question is, do I have to, if I don't use a HIPAA compliant platform, then should I document that I didn't and why? You know, again, I recommend
Not this time.
use a HIPAA compliant platform, and you don't have to worry about this because you have free and low cost options. In theory, though, if you did, then I would assume it would be wise to document it in a way that's consistent with that announcement made by the U.S. Department of Health and Human Services for the exception. But that's my opinion. I wouldn't. I'm not an attorney, but just my opinion. I did real quickly want to show you guys this app. This is the Telemental Health app I've been telling you about. And on the left-hand side, you should see it on my screen. It says state guides. So if you click on state guides, you can choose whatever state. Last night, I chose a state that had a very interesting rule. I think it might have been West Virginia. So I clicked West Virginia, and then I clicked counselors. And it gives you everything you need to know about doing telehealth with people in that state. If you click on licensing requirements, they will tell you are there any licensing requirements specific to telemedicine or telehealth in that state? And the answer for West Virginia is yes. And then it tells you exactly what it says in their code. If you scroll to the bottom, you will see that they do allow people who are licensed in other states to render counseling services in their state for up to 30 days in any calendar year. So there are weird rules and laws in every state, and this is your way to look them up.
Great. All right, next question. It's a two-part question. Do you have suggestions for a model or template telehealth consult form? Two, I'll let you answer that first, and then we can move on to the second part.
That's a great question. You know, if you were to Google telehealth consent form, you will find a number of forms out there. First thing is, some of your malpractice insurance company, contact them and they will point you in a good direction. Some of them have free consent forms that they're offering to their members and then telling you how you can tweak it to make it your own. So that's one resource. Second, the American Mental Health Counselors Association is about to put out a recommended minimal telehealth consent form with the additional comment that you should look at, is there anything specific to your state that you might want to add, and that sort of thing. So that announcement should be coming out soon. I Googled various associations like NADAC telehealth consent form and found one. If you look at FOMCA's forum, the COVID-19 resources for counselors thread, you will see that we have posted various links from various authoritative sources on sample consent forms. So I'd recommend going into that forum and then pulling up some of those resources and taking a look at them.
Okay, the second part to that question was, I've just had a potential new client reach out who is dealing with depression and suicidal thoughts. I am currently only providing telehealth. My gut is to find someone who is still doing in-person sessions and refer this client, as I am uncomfortable with treating suicidal ideation over telehealth. I would appreciate any comments or suggestions on how others are handling this.
That's a good one. See, I'm still providing in-person services for a minority of clients. So as I think of myself being in that scenario, I probably would be meeting with that person in person as well. But for those of you who are doing in-person appointments, understandably,
You can also triage with psychiatrists and working with that, and bring in bring the family or the people that are in the home into that plan as well.
Okay.
And I see Erin's frozen.
those precautions would make sense.
There he is.
I also believe that telehealth is better than nothing. And there's a lot of research. Okay, I'm back. All right. So,
Yeah.
so let me see here. I'm not sure where we left off, but I was saying I do provide in-person services still. So I might be prone to meet with an individual like that in person. If I wasn't, I think I would maybe try to point them to an in-person resource that's still available. But I also believe that telehealth is better than no health. So in fact, for people who are dealing with suicidal ideation, there are suicide prevention hotlines, text lines, and chat lines, like the National Suicide Prevention Line, and that's better than nothing. So I think you'd have to look at it on a case-by-case basis, try to get them to an appropriate resource, and if there isn't one, you'd have to make a decision: is it better for them to do telehealth than nothing? Interesting.
Yeah, and I was talking about triaging
dilemma.
also. Yeah. It's also helpful to get other people involved in their homes. That's why you keep an address on file and a person for emergencies on file, so you can contact them if there is suicidality going on. Currently, I'm triaging with a psychiatrist to assist with, that type of a situation with one of my clients. So we're working through that with the family and with other resources.
Okay, next question. Can you clarify that clinical supervision can be provided only if the registered intern was being supervised before March 19th?
No, we were asking the registered interns to have existing supervisors, qualified supervisors. That was the thinking behind that, is that we wanted to make sure that the registered interns had existing qualified supervisors.
Okay. Another question. I am still confused. Can audio or just telephone sessions only be covered by insurance during the pandemic?
There are exceptions, but we've read many authoritative sources and posted some in our forum that say that generally insurance companies do not reimburse for telephonic versus telehealth, which is audio and visual appointments. However, I have seen a few exceptions. So if you go to the COVID-19 resources, or COVID-19 and insurance resources thread, you'll see that we have posted that some insurance companies, just a couple maybe, have said, yeah, we're going to do telephone sessions, but most of them have not said that. So we would assume that most insurers at this time are not reimbursing for telephone sessions.
Okay. Next question. So a graduate intern cannot do video sessions?
Well, we have dealt with that issue a couple times already. My interpretation was what that board rule says is that they can't count telehealth appointments towards their 1,500 hours of face-to-face psychotherapy because it doesn't fit the definition of face-to-face psychotherapy. However, another interpretation is no, they can't do telehealth at all. But right now, during the pandemic, there is a 90-day emergency rule that the 491 board has put into place, which temporarily allows registered interns to provide telehealth appointments to their clients and use them towards their 1,500 hours of therapy, provided that they have a qualified supervisor, they have an appropriate protocol, and that the client's relationship started with the intern prior to the date, March 19th. And that if they're in a private practice setting, they have to have a licensed mental health professional on the premises when they're providing those services.
Well done.
I know it's complicated, but I'll put back on that slide though, so that you guys could see that and refer to it here.
Okay, next up, Erin, if you could remind everyone how to use the forum and how to subscribe. We have that question a few times.
Yeah. So I'm going to take it off the screen. I'll bring it back in a moment though to show you guys that again. So this is fmca.org, fmhca.org, and I'm just going to go to the home screen because that's the screen you would probably see. The first thing that you need to do is make sure that you are signed in. I'm already signed in, but let's say that I wasn't. I would click up here and I would enter my email address and password to sign in. Once you are signed in, then it knows that you are a member and it will activate this link, Member Forum, under Membership. So you click on Member Forum, and voila, here's our forum. You can see I'm already subscribed, but I'm going to unsubscribe so you can see what it would look like if you were not subscribed yet. And you would want to click Subscribe to Forum. And when you see that green check mark, you know you're good. You were subscribed and you're going to get that daily digest. So if we post a new resource in the COVID-19 resources for counselors, or Dwight Bain, a wonderful member who is great with disaster mental health, posts many things for us about COVID-19 updates, or the COVID-19 and insurance reimbursements. If anyone posts something there, you will get a notification once every 24 hours of all the activity in the forum.
Okay, thank you, Erin. Next question. Are at-risk populations of providers being considered in the emergency rules? For example, a provider over 60 who has an autoimmune issue.
So my personal opinion is if I were a mental health professional and I had an autoimmune disorder, or I was particularly vulnerable or sensitive to COVID-19 infection or complications, I would probably not provide any in-person services. As far as I'm aware, mental health professionals can choose to not, if you're in private practice, you can choose to not meet with people in person. In fact, half of you are making that choice, according to the polling questions earlier. And
yeah, and I'm in the age group I've been told to stay home, so everybody's online with me now.
Yeah, my personal choice is, that I'm, relatively young and healthy, and I am willing to take appropriate office precautions and still meet with a small number of clients who cannot access me through telehealth. But I could change my mind tomorrow.
Yeah.
Okay. I only accept private pay in my practice. How do you recommend accepting payment for telehealth sessions?
Square
is a good resource. I have a practice management system, Therapy Notes, so I can use that. But if not, I would be using Square. My website has a PayPal payment option, so that would be another way. But any of those electronic resources like Square or PayPal, I would think would suffice.
Also, Venmo, Venmo.
Okay. Do you know if there are organizations looking for providers to provide telehealth?
Well, I just got an email from New Directions Behavioral Health asking me to sign an amendment to my contract indicating whether I'm available for telehealth services or not. So there are some, apparently some EAPs and insurers that are reaching out and trying to clarify who takes telehealth and who doesn't. But that's the only example I can think of off the top of my head. If someone else knows something, they could certainly type it into the questions box.
Yeah.
We could share it. Or even better, put it in the member forum.
Yes.
Yeah.
So everyone can benefit from it.
Okay, next question. I am licensed in 2 states, and I've heard Florida has allowed licensed counselors in other states to also provide counseling services for Florida residents. What is the process for this?
I don't understand. Clarify that for me.
Okay, so let me read the question again. I am licensed in 2 states, and I've heard Florida has allowed licensed counselors in other states to also provide counseling services to Florida residents. What is the process for this?
If you're out of the state of Florida, if you're not licensed or a resident of the state of Florida, you can apply with the board to provide telehealth to clients in the state of Florida as long as you don't live here and you don't have a license in the state of Florida.
If you go to floridasmentalhealthprofessions.gov and you click on resources and then scroll down, you will see right here, telehealth information and out-of-state telehealth provider registration. Click on that and read all about it. It tells you all about the process for registering if you are not licensed in Florida, but you wish to do telehealth with people who are in Florida.
Thank you.
Thank you, Erin. All right. Is it accurate to say that current graduate student interns are not governed by the 491 board? Rather, they are governed by their university, including accrediting bodies?
If you are acting as a therapist in the state of Florida, though, you do have to abide by certain criteria.
Yeah, it's a complicated question, in my opinion, because, for example, if you're a graduate student and you're not a registered intern nor are you licensed, but you say, hey, I'm a psychotherapist. Uh-oh, you just broke a Florida statute. So, of course, there are still going to be laws and rules that apply to graduate students. But I think ultimately, since you're not licensed by the 491 board,
Erin, they're working underneath, but they're working underneath other people's licenses. Like the students that were in my university worked either under my license or another faculty's license. And yeah, there's repercussions for both the student and the person that they're working under their license. So you can't just go out there and do what you want because you're not a licensed clinician, but you are working under the licensure of another clinician in order to practice in the field. So you are governed by the board indirectly.
Yeah, and you might also be a student who works in, say, a DCF licensed substance abuse treatment program, and then there's a whole set of statutes and things about that.
Yeah.
So
Mm-hmm.
probably the best answer we'll be able to give for now.
Mm-hmm. It's about as far as we can go.
Okay, next question is WhatsApp HIPAA compliant?
I don't think it is. I could be wrong, but I'm pretty sure they list it as an example of a non-HIPAA compliant resource.
They're not.
Okay. Let me see here. I think I missed the answer. Are registered interns able to bill for telehealth visits?
Well,
Under
go ahead.
Yeah, again, if you're under a private practice, of course, you have to be linked into another licensed clinician, and I can't see why you couldn't bill for the telehealth service. You're billing for on-site services, so it's just a different method of billing. Erin, you see it any different?
No, I mean, broadly, I would say, yeah, you can bill for services where you get paid. I mean, if it's private pay, you certainly would be billing for it. Can you bill insurance? Well, you can, but will the insurance company pay you? It depends on various factors. Are you on that insurance company's panel? If not, do they have out-of-network benefits? Does that insurance company pay registered interns? It would be a case-by-case basis.
Company by company basis, yeah.
Yeah.
Okay, and I think we have time for just one last question. Who is the best contact to submit questions or concerns regarding telehealth rules, especially for interns?
Well, good question. Because on top of my head, I would think the 491 board would technically be the ideal resource on board rules for interns. We would be happy to point you to those rules at FOMCA, but I would think that technically a 491 board would be the best contact.
And it's the responsibility of the registered intern to be knowledgeable about this. So you've got the resources here. You've got the board's website. You've got FOMCA's website. You don't work out of ignorance. You've got to know this stuff. Laws and rules.
And what about your qualified supervisor? That should be the person who's helping you figure out the answer to the stuff and who to contact.
Yeah, but the registered intern is ultimately responsible for their knowledge. They have to ask the questions. They have to be looking for the information. And you've got the resources right in front.
Okay.
Now, if you do want to contact FOMCA, though, I'll put back that slide here. Our phone number, our email address, and by all means, it's all there in the forum. Also, you can always post a question in the forum too.
Absolutely. Okay, so as we are finishing up today, just a friendly reminder to complete the webinar evaluation form, which will appear on your screen after I am done talking. If you miss it, you will have a second opportunity as the link to the survey will arrive in a follow-up email. We will be sending you in 1 hour. Please complete the evaluation form within the next 3 hours so that we can input your CEU information into CBroker. All certificates will be emailed. If you have any questions after the webinar, please direct them to office@flmhca.org. Erin or Dr. Denny, do you have anything to say before we end the webinar today?
Just make good common sense. Good common sense decisions about your safety, your client's safety. That's really what's the most important part.
Yeah, I want to say take care of yourselves, and also by relying on each other and by connecting with each other, our colleagues and through our association, I am very confident that we will be able to stay anchored and balanced as mental health professionals, and that we can pass some of that hope and resilience and stability on to our clients as well. So please keep collaborating with each other. That's important during this difficult time.
Yes, I made a suggestion on the forum to contact 2 people a week that are clinicians that you're colleagues with and support them. That's what I've been doing every week, just to checking in, making sure they have the support they need as a clinician. We're being inundated with multiple layers of complexities here.
Absolutely. Okay, so with that being said, we wish everyone a happy and fulfilling rest of the week. See you next time.
Bye-bye.
Bye-bye.
Y'all take care.
See you next time.
Bye-bye.